I'm announcing Yolande Voskes to you. She is one of the companions in the department that has a real high spirit for education. She is a coordinator in the department for all the ethics education that we have on offer, and she does a wonderful job, especially in crisis. So if a lot of people drop out, then Yolanda is at her best. But I do not always want her to be at her best because it's not a good sign, I would say. She has recently been nominated for an award, a teacher award in the VU, and let's await whether she wins it or not, but I keep my hopes up. And she is going to present some work that we are doing together with Guy and Marielle on ethics education and research on it. And I think, well, the title was Road, yeah, the road. So she was already smiling this morning when we saw the road presented by Irma. And Yolanda, I think the floor is yours. And thank you for presenting also today.
Thank you so much. Okay. Yeah, so on the program there is Marielle Diepeveen, that's my colleague, and due to circumstances she cannot, yeah, she is here, but she cannot stand here, but maybe you can stand up. Then they know this is Marielle, but I will be the stand-in today of Marielle. And yeah, the title is The Road to an Integrated Course in the Medical Curriculum, Development and Evaluation. And it's quite funny because Irma finished her presentation with The Road, and I didn't know that. And I would like to tell you something about the way we traveled to develop a new course, because in 2015 we changed from curriculum, and then I became the coordinator of a course at the end of year 1 of the bachelor. And yeah, so it was the beginning of a development, and I would like to tell you something about that, and also about how Marielle and I evaluated that. So, and Confucius, I think he understands it, because he said roads were made for journeys, so not destinations. So we are not finished yet. So we are still traveling. We are still on our journey. Yeah, maybe if you have good ideas or suggestions, please let us know. So, yeah, there is an increasing awareness of the need for ethics education, so we know that. But there are also some challenges, and one of the, maybe the most important challenge, and it's also, this presentation is also about that, is how to integrate ethics in the medical curriculum. So, yeah, when there is too much integration, so yeah, students may not be aware of that ethics is a real discipline. But when there is too little integration, then yeah, maybe students think, okay, yeah, it's detached from medical practice, and maybe it's confirming students that ethics is a philosophical, theoretical, separate subject. So yeah, we have to find, I think, a balance between too much and too little integration. Also, a challenge is on the relevance of ethics. So I don't know. I think many people know or know that feeling that you think, oh, medical students don't like ethics. So I don't know. Maybe do anyone? No? Yeah, yeah. Thanks. Rien. Yeah, thanks. Or law, yeah. So.
Some students are very much interested in understand the relevance, and others are totally ignorant and think, oh, this is not really.
Yeah. But sometimes I have that feeling that I think, okay, oh, students don't like it. They say it sometimes. So, oh, ethics is a little bit fake and it's a little bit boring. So we are busy with that. And also the last challenge is how to assess ethics education, because we are in a biomedical curriculum. There are also the way of assessment is also a little bit biomedical, so a lot of multiple choice questions, and the medical humanities and also also ethics doesn't suit so well in that multiple choice system. So that is also a challenge, how to assess ethics. And I think to deal with these challenges, you need both systematic development and also evaluation. So I talked about the course at the end of year 1 of the bachelor, and the name of that course is Physician and Patient 2, Autonomy. And it's a 3-week course, and the central theme is autonomy. And it's the first major encounter for students with ethics. So before sometimes they had a little bit ethics or a little bit research ethics, but not really the medical ethics. And it's in close cooperation with nephrology, healthcare law, and also diversity. So here you can see the important topics, and the topics are too much to say them all, but we have nephrology. So you can see nephrology as something like a somatic, how do you pronounce it? Anchor? Anchor? Oh, anchor. Yeah, problem. So that is the somatic anchor, and then we have law, we have diversity. My colleague from diversity is here on the front row. Ethics, the most important topics for ethics are the 4 principles. We all know, I think. Autonomy, so autonomy as positive and negative liberty. That's not very easy for students. We experienced the models of patient-physician relationships, so the models from Emmanuel and Emmanuel, but also shared decision-making, and recognizing values, norms, and dilemmas. And so we are also not really doing, but explaining and show them a moral case deliberation. So, and the learning objectives is on 3 levels. So on the level of knowledge, so we students acquire knowledge about basic principles in medical ethics. Students recognize ethical issues, so they are sensitive for ethical issues and ethical dilemmas in medicine in general, but also, and in particular, for nephrology. And maybe the most important one in this course is that they are able to apply this knowledge to patient cases. So what are the learning activities in this course? So first we have the lectures, and that is for the whole cohort. So that is for 360 students, 360 first years students, and it's almost 9 hours per week. And the lectures are given by course coordinators and lectures from the related disciplines. And then maybe you think, okay, and how is the integration then in the lectures? So sometimes I will tell, for example, I will tell something about the models of Emmanuel and Emmanuel, and then after that lecture, I will ask a physician to talk with me about that model. So is he or she aware of the models, and how is he or she handle it with the models? And sometimes I really we really give the lecture with 2, so with an ethicist or also a lawyer and with a physician. So, and sometimes it's nice because then there is a physician standing next to me in a white suit, and then he said, "Oh yeah, ethics is really important." And I think, okay, yes. So working groups are with 12 students, 2 meetings of 2 hours per week, and they are making assignments. So that's an assignment. For example, the case starts with a medical problem, so with a patient with a medical problem, nephrology, and then the case become worse and worse. So, for example, the patient said, okay, I don't want that treatment. And how to deal with that patient, and how can you use the theory of ethics or law in that case. And it's supervised by tutors, and they are not content experts. So then we have practical trainings that are also 12 students, 2 to 6 hours per week, and that are teachers who are content experts. And for example, they have also practical trainings about clinical reasoning, but also we have a practical training about autonomy, where we discuss cases with students about autonomy and also about negative and positive liberty. So, the evaluation of this course. So there is a standard evaluation. We heard a lot about that this morning. It's done by the Faculty of Medicine. And we also did a questionnaire before and after the course. So the standard evaluation, there are different elements. So the course program, the assessment, the working groups, the course coordinator, questions about, and also questions about the aims of the specific patient physician courses. So that's our questions, for example, medical knowledge. You put medical knowledge in a broader context, or there is a relation between medical knowledge and practice. So they are specific for this kind of courses. So because there are 5 patient physician courses in the whole curriculum. And also additional questions regarding the practical trainings. And they do it on a Likert scale, so from 1 is low to 5 high. And also 2 open-ended questions, so what did you value, or what are your points of improvement about this course? So the results of the course were quite high, were quite good, because it scored, overall it scored above average in comparison to the other bachelor courses. So for example, the content scored a 4, and I thought I have to mention that because the lectures scored a 4.3, so that are my colleagues, so I think that's a good thing. So we have good lectures on our department, but also in our hospital. Examination, a 3.8, and specific questions related to the patient-physician course, also a 3.8. And one of the quotes on the open-ended question was, this course focuses on the patient-physician relationship, and let us think about what kind of doctor we would like to become and which values we find important. With this course, we become real doctors and not only students who know a lot about the human body. So that was a nice quote. Sometimes there are also not so nice quotes, but this was a nice one. So we were quite glad that they were satisfied. But then the question was, have they learned something about ethics? And then we thought, okay, let's start. And we started with a questionnaire before and after the course. So 5 statements regarding the students' view on ethics education, and also 5 statements about the goals of ethics education. And it's on a Likert scale from 1, so I do not agree, to 5, I totally agree. So here you can see the statements. So as a physician, you will be confronted with moral issues every day. Medical ethics is important for my work as a physician. Medical ethics is interesting. Medical ethics is a matter of opinions, and having knowledge of medical ethics is important prior to having contact with patients. And what you see here, and maybe you say, okay, there are 74 students, and it has to be 360. So it's very difficult to involve students, but for the normal evaluation. But this was, my course is the last course at the end of year 1, and students are really tired. They just had an assessment from the course before, and then most of the time they think, during the opening, they think, okay, I will leave that, and I will see that online, because also the lectures are online. But what you see here is that it's not, they scored quite high. Also on medical ethics is important, but there was not really an increase when it comes to the goals of goals for medical education. And we were discussing these results, and then we thought, medical ethics is a matter of opinions, and then it didn't change at all. And then we thought, are these statements, are they sensitive enough? So can it be that there are different views behind this question or behind this statement? So, for example, students can think, this is ethics is subjective, so and it's a little bit vague, what I said. But they can also think, ethics is a matter of deliberation and discussion, and maybe they replaced one meaning for the other. So that was a thing that we thought, maybe we have to look at the statements if they are sensitive enough. So these were the statements about the view, the goals on ethics. And here you can see that it increased. So, and especially for the first statements, so I can explain what medical ethics is about, and I can point out the difference between medical ethics and healthcare law. So you can see that, wrong button, But you can see that they scored quite low, and they scored higher at the second measurement. So the discussion, so the use of lectures and assignments combining ethical and clinical aspects fostered real integration. And one of the other discussion points was, is there a need to focus on convincing students that ethics is important? Because the evaluation was quite positive about how they think about ethics. So a greater specification of the evaluation is needed to gain more understanding of the extent to which the course has changed the students' views on ethics education. And maybe we thought, when we want to have a deeper insight in the experience of students, we have to do qualitative research. So, and now maybe you think, what about the challenge of the assessment of ethics? What about the master program? So more research is done or is coming, and that's done in the PhD of Marielle. And so she did the research of the evaluation of the course. She also doing research on, or she did research on the experiences of students and teachers with the OSCE, so the observation, I always forget that. Objective structured clinical examination. Yeah, thanks. For ethics law, diversity and patient safety. She did that together with Guy and also Petra here on the front row. In the master program, we evaluate the use of moral case deliberation during the internships elderly care, and she did also research on finding the right middle when it comes to compassion, and they developed training for residents in the Netherlands. So I think it's important to do research, but maybe it's also important that we share experience, we share knowledge. So give back what you have learned, give back what you have learned in practice or in research. So if you like to join our community of practice of lectures, medical ethics in the Netherlands, you can contact Marielle or me. And do you like to read more about integrating ethics? There is an article, a publication about this topic. So that was it.
Given the time, who has an urgent question? I think this is a nice example of what subtle research can actually look like, even without not knowing that you are conducting something like subtle research because you only learned about it this morning. Tamarinda, the floor is yours.
Yeah, thank you. I was wondering, you mentioned, which I thought was a very interesting question, they had this sort of multiple choice exam and then you were still in doubt about whether they had learned anything about ethics. But then what you rated was either agreement or something of a self-assessment. How does this help us to understand if they've really learned something about ethics?
Sorry, I didn't. So your question is one more time. Sorry.
You presented the 2 sets of questionnaires that the 74 students answered as a way of getting insight into have they now learned anything about medical ethics?
Yeah. Okay.
And I was wondering if the way of measuring that would be the right way, provided that you ask them to give agreement statements. And I don't really know if agreement statements tell us a lot about have you really learned something. And it was also a form of self-assessment. And I think self-assessment here might also come with some complications. So what would be your response to that? Thank you.
Yeah, it's a good question because I don't know if it's the right way to assess or to know if they learned something. We also have assessments to test if they learned something. But what the problem is with the assessments that students can compensate in our assessments at the moment, they can compensate. So if they learn very good for nephrology, they can compensate for ethics or law or that's the problem when it comes to ethics education. I don't know if
you could count if they just skip the question.
Yeah. But I think we have to think about how to measure if they learn something, or and also to reflect on if we can measure it, because I don't know if that's really possible, or maybe better with qualitative interview to ask them. Or
so much more to be done.
Yeah.
Yeah. Thank you very much.